Hi, I'm Dr. Marilyn Smith-Stoner, Associate Faculty Member at California State University Department of Nursing. I'm pleased to present the student production on Timed Up and Go Fall Assessment as part of an honors program in the undergraduate program and their work with our partner Kaiser-Metro Home Care. If you have any questions about this content or this video, please feel free to email me, and my email address will be at the end of the video. Thank you.
The Timed Up and Go Assessment, or TUG, is an evidence-based assessment tool used to rate patient mobility and identify patients at risk for falls. The TUG assessment is provided in accordance with new Centers for Medicare and Medicaid Service Regulations, Healthy People 2020 Objectives, and Joint Commission on Accreditation National Patient Safety Goals. In this video, you will be introduced to the TUG assessment and view a demonstration of the assessment in the home setting. The objective of the video is to enable staff to implement TUG effectively in home health, palliative care, and hospice settings. Pre-TUG considerations. Ask the patient if he or she wears glasses or if they are experiencing any visual problems. Patients should wear glasses and use assistive devices such as a cane or walker if applicable, but may not be assisted by another person. They may stop and rest, but not sit down if they need to. Additional considerations include environment, people or pets, documentation of 5 or 10 foot tug, blood pressures, or pulse ox if applicable. Tug steps. Before beginning the test, explain or demonstrate the test to the patient. Ask the patient to sit comfortably in the chair. The patient's back should be resting on the back of the chair. Make sure that the chair is stable and positioned such that it will not move when the patient moves from sitting to standing. Place a piece of white or bright colored paper on the floor, 10 feet away and directly in front of the chair so that it is easily seen by the patient. You can also use a household item such as a washcloth or paper towel to substitute for the paper marker. Instructions. On the word ready, set, go, you will stand up, walk to the paper on the floor, turn around, and walk back to the chair and sit down. Advise the patient to walk at their normal pace. If the patient experiences dizziness upon rising, they may momentarily stand still until it is resolved. Start timing on the word go, and stop timing when the patient is seated again. The patient is scored according to their time in seconds required to complete the entire task.
Hello, Mrs. Rodriguez. My name is Gabriela Diaz, and I'm here from the Home Health Agency. I'm here to perform a TUG assessment. TUG stands for Timed Up and Go. It's an assessment to see how well you are walking. I will go ahead and demonstrate it for you first. Do you have any questions?
Should I use my cane? I don't use it all the time.
It's up to you. If you don't use it all the time and you can do it without, you can. It's really your decision.
Okay.
I may have to move around some furniture. Is that okay?
Mm-hmm.
And let me see what type of shoes you have. Oh, perfect. You have tennis shoes, which are a really great shoe for this assessment. Okay, well, if you don't mind, I will rearrange some furniture and we can get started.
Okay.
Okay, now I'm going to demonstrate tug for you. You're going to start off by sitting down. When I say ready, set, go, you're going to get up. You're going to walk at your normal pace until you go around the marker. Now, although this is a timed assessment, it's not a race. And if your phone happens to ring or doorbell, I'll take care of that. Just finish the assessment. You sit back down, and that concludes tug. Do you have any questions?
No, I think I got it.
Okay. Okay, I'm just setting up the timer here on my phone. All right. When I say go, you go ahead and get up, okay?
Okay.
Ready, set, go.
That's my doorbell.
go ahead and grab that in just a second. Great. Well, we're done now.
We're done with tug.
Tug scoring scale. Tug is scored on a scale of 1 to 4, with 4 being rated as very high risk and 1 being rated as minimally high risk. Key points for the cluttered home. The clinician should strive to achieve a clean area around the assessment pathway. Be mindful of tables, clutter, lamps, and other items that may injure the individual if a fall occurs during the tug assessment. Appropriate audience during the tug assessment. Children, animals, and adults that could reasonably interfere with the outcome of the test should be dealt with accordingly. Adequate lighting and visualization of the reference point. Be sure to ask the individual if they can see the reference point. If they cannot, the tester should then alter the environment accordingly to achieve desired outcome. A sure-footed client. Use socks with grip or appropriately fitted shoes during the testing procedure. Perform procedure on carpet if available to increase traction and reduce the risk of a fall during the assessment. And finally, provide a stable starting point. Make sure that the individual's chair is well anchored and will not shift or move as the client starts the tug assessment. Ideally, the back of the chair should be placed against a sturdy table or a wall that can be utilized as a brace.
Hi Patty, my name is Matthew Rodriguez and I'm with your home healthcare agency. We're here today to do a tug assessment. Have you heard of a tug assessment in any way? No. It's called the Timed Up and Go assessment, and what it is you're going to be sitting in a chair, asked to stand, or I'm going to say ready, set, go. On go, you're going to stand, walk out a distance, come back and sit down. I'm going to time you on that, and what it does is it measures your ability to move around, your mobility. Did you have any questions about that?
No, is it alright if I use my walker?
It is okay if you use your walker. I can see that you're wearing glasses and that you have nice shoes on. The only thing that I'm going to need to do is set up the room a bit because it's a little cluttered in here. I don't want you falling and injuring yourself or anything that could cause an issue with that. So let's go ahead and set up the room and then I'll demonstrate the assessment for you.
Alright.
Okay. So, you're okay. And my tape measure. And my paper. Can you see this color here?
Yes.
Okay. Okay. Now, let me go ahead and demonstrate this to you, how this is going to work. I measured out 5 feet behind the paper, so what we're going to do is when I say ready, set, go, you're going to stand like this, ready, set, go. You'll stand, walk at a normal pace, it's not a race. Walk your walker around the paper and back to a sitting position, like so.
Alright.
Now, it's very important that once you start the test, to finish the test. It is timed, not a race like I said, but we want to make sure that we're getting an accurate score. So if there's any interruptions, phone calls, animals, acts of God, anything else that happens, just continue the test as normal.
Alright.
Okay? When I say ready, set, go, get up and go ahead and do the test. Okay, ready? Okay. Ready, set, go.
Okay. Oh.
Oh, just continue the test. We can call them back.
Okay.